The reason somebody should go to a periodontist as opposed to a dental practitioner to get a dental implant is because with a periodontist, they specialize in gums, and gums are the most aesthetic part of your smile. So while most general practitioners will plan something, just make sure that it will fit, a periodontist will always make sure that it looks good. In addition to that, you have to take into consideration the education of both a general practitioner and the training and education of a periodontist. A periodontist will go to school for 4 years in college, 4 years of dental school, and then do 3 years of a specialty, where all they do is that specialty. In addition to that, in the case of Dr. Singletary at North Raleigh Perio, he did a diplomate, which was an additional 6 years after his 3 years of surgical practice. That's 4 years of college, 4 years of dental school, 3 years of specialty, and 6 years of a diplomate. That's 17 years of education and training. You get what you pay for. Whereas with a general practitioner who's a DDS, your local dentist or whatnot, they did 4 years of college and they did 4 years of dental school. And while they are qualified to place dental implants, it's sort of like going to a mechanic that's only been working for a few years as opposed to going to a master technician. You know what you're going to get, and you're going to get reliable results every single time. So that's why you should go to a periodontist as opposed to a general practitioner when you're considering implants. One of the questions we get here a lot at North Raleigh Periodontics is, why do I still have to see a restorative dentist after Dr. Singletary places an implant? The reason for that, Dr. Singletary, he's a specialist. The only thing he's concerned about are your gums, how they look, and how your implant functions. All right? So it's sort of a team approach. He makes sure that your gums are pink, they're looking great, it's a very important part of aesthetics, and that the implant is integrated, that it's sitting perfectly, and that it's fully integrated. A restorative dentist, their primary function is to make sure your teeth, not your gums, but your teeth look great. So by working with Dr. Singletary and a cosmetic or restorative clinician, you're able to achieve the best aesthetic result. One question we get here a lot at Raleigh Periodontics is a price. How much does this cost? Why does it cost more than if I were to go to my general practitioner? And the simple answer to that is Dr. Singletary is a specialist. He is an expert. Okay, we have people that fly planes like crop dusters, and we have airline pilots, and then we have Top Guns. Dr. Singletary is a Top Gun. He has 17 years of training, education, in addition to 30 years of clinical experience. Whereas most general practitioners, they've got about 4 years of dental school, and if they're lucky, they might do 2 or 3 implants a month, maybe 30 or 40 a year. Dr. Singletary does 250 to 300 implants a year. In his lifetime, he's done about 8,000 implants. Whatever can go wrong will go wrong at the worst possible time, and he's seen it all, and he's made adjustments, and he's been able to overcome that. Not only that, his success rate, as far as integration, stability, and making sure that the implant sticks, is close to 98%. There was a study that just came out from Harvard about 3 years ago. The average failure rate for a general practitioner is almost 19%. It's like 18.7% of implants placed by a general practitioner will fail. Okay, with Dr. Singletary, his success rate is 98% plus. So what you're getting for, you're paying for a predictive outcome. You're paying for an aesthetic outcome. You're paying for his 30 years of experience. You're paying for his 17 years of education and training. Because you do get what you pay for, and if you want the best and you want the value and you want the quality and you only want to do it one time, you better believe you want to go with either a periodontist, a prosthodontist, or an oral surgeon. And either one of those specialists will do a great job with the dental implants, but everybody, if you ask around, will tell you if you want an implant to look good, especially if it's in the smile zone, if it's in your aesthetic zone, if it's something that people are going to see, the tooth is only part of it. The gums are what make it. And Dr. Singletary's business is gums. That's all that he's done for the last 30 years of his life. And he does it very well. So when people ask us why our prices are a little bit more, you get what you pay for.